I think the relevance of the work that Dr. Hussein has presented right now, I think is double. You have to understand that I think not only this work has proved that olaparib, this drug, is superior to the control arm. It's not only that. I think this study has demonstrated that now prostate cancer can be treated as a targeted or with a targeted therapy approach. Putting these in more simple words, not all prostate cancer patients have the same tumors. And this is the first time we've been able to identify that we can more precisely characterize the molecular biology, the genetic background of these tumors, and that is going to determine how we treat them. So double hit, superiority in terms of efficacy, and has proved a new concept that in prostate cancer had not been proved before. So targeted medicine works also for prostate cancer.